Thank you for my colleagues for the earlier presentations. They've all been really engaging, and I'm really happy to be with you all today. So just as Arlinda mentioned, I'm just going to be talking about some of the educational programs that the RST has been working on and plans to work on, and some of the research around those educational programs. So just as Hilary has mentioned, we recently developed a massive open online course, and that was in response to an ask to develop some materials to counter the rapid spread of misinformation that we were seeing in February, March, when this outbreak came to a lot of our attention. So based on our own experience, as Hilary mentioned, with developing these massive open online courses, we felt it was appropriate to do a similar thing. And with the experience we'd had in the past, we were able to develop it at pace, as Arlinda has mentioned. And just very much in line with everything that's been mentioned today, definitely not working alone in doing so, working with our partners and with collaborators from the London School of Hygiene and Tropical Medicine. So we had contributions from the WHO, Africa CDC, University of Hong Kong, National University of Singapore, just to name a few. And the target audience, as you can imagine, when it comes to addressing the spread of misinformation, initially we thought, okay, should it be for healthcare professionals? But with more discussion with our partners, we felt it was actually appropriate to broaden that and make it really applicable to just about anybody, healthcare professional or not, that would be interested in learning more about this topic and getting the facts and where the evidence was coming from. Following that then, it's important to review what we did. So yes, it was done and it was relatively well received, which I'll speak about a bit later, but we also feel it's important to look in detail at what it was that we did, such that we can inform what we do in the future. So we have adopted an action research, we adopted the action research cycle as a conceptual framework for this look at what we did for the massive open online course on COVID-19. And for anyone who's not familiar with the action research cycle, I've just put in this diagram here to give you a quick depiction of what it entails. It is a relatively simple but well recognized approach that allows you to look systematically at just about anything that you do, looking for lessons learned, and in order that you can share those lessons learned. So the research study that I'm working on at the moment will go through the course matrix, the pre-course comments and the surveys, the pre and post-course surveys. We'll also look at the input from all of these different contributors, our course moderators, as well as the institutions and individuals who provided content for the course. And we're doing that in a number of different ways, using the research methods that we have adopted for different programs, such as focus group discussions, semi-structured interviews, and so on. And look specifically at the tools that we used, adapting them. Do they need to look differently if we do this differently and if we do this again in the future? But I think a really important part and a driver for this particular piece of research is to develop a framework that can be picked up by our partners and can be used by other individuals within our team to develop courses at pace on the emergence of a new outbreak, to provide this kind of mass information if required. We're seeing at the moment that, you know, a lot of these kind of massive open online courses are coming from the UK or Western countries, and we would love to see that that shift change. And if this is something that can support that, we would be very happy to see that be the case. And that's based on discussions that we've had with our partners. Just a snapshot of findings from this, quite a bit of review, but I think the talk would go on far too long if I gave you all of the findings. But just to give you a quick snapshot, as Arlinda mentioned, you know, over 230,000 enrolled from 184 countries. That's 184 out of 195 countries. Relatively good distribution across the age groups. They're ranging from 18 and sometimes younger to well over 65. And good responses from course participants, in that we had 99% of course participants reported that the course either met or exceeded their expectations. Similar sorts of numbers reporting that they gained new knowledge and that they shared that knowledge with people that other people that may not have taken the course. And 84% of learners reporting that they had applied that learning. All these sorts of things are things that we want to see from our courses. So allows us to say, okay, this what could be seen as a good example that we can model. And if we can provide a way for us and others to do this at pace in the future, that might be a good thing. Similarly, as well as the responses from the course participants, we could see that the course was influencing the ways in which COVID-19 was being reported globally. So this was picked up by a number of different media outlets and institutions, some of which I haven't detailed here, but it just gives us an impression of what these kind of courses can do. So we're now starting to see some of the phrases we're using in the course being used in the news as the way in which we describe COVID-19 and so on. So that was just an example of a piece of educational learning that we have developed and then how we've gone on to look at it with a research lens. I'll just now take you through a very quick snapshot of the other activities that we are planning within the RST and again, the research that's associated with that. So we plan to develop a massive open online courses on my brain. We plan to develop a master's in pandemic preparedness and response. We're working on that now in collaboration with the London School of Hygiene and Tropical Medicine. Very much wanting it to be applicable to low and middle income countries. And so very much looking to bring together our partners as we did for the massive open online course. Those of you who may have taken this MOOC would be familiar with the FutureLearn platform. On the FutureLearn platform, they are launching micro-credentials, which is something that is being launched across different entities at this time. And what they are is discrete, standalone, but credit-bearing, so having academic credits attached, short courses that you can take as a standalone course, or you can add up to make up a degree program. And we're also looking at providing this based on feedback from our partners, that this may be something that, say, if someone doesn't want to commit to doing a full master's, may just want to take a short course and then at least have something in the bank that they can put towards a master's or other degree program in the future. The key component of both of those programs, the master's, the micro-credential, is interdisciplinary learning. So we have seen over the last, looking over the last 2 centuries at the pandemics and the response plans, we have definitely seen there's an importance being played on interdisciplinary working. So needing to work across disciplines, across institutions, individuals needing to understand what their colleagues of different disciplines are doing so that we're not working in silos. So we really think that's very important to bring that into these new programs that I mentioned, a lot for the benefits that are detailed in this lovely infographic around interdisciplinary learning. And then looking at it from a research perspective, we think, okay, actually, yes, we recognize that this is important, interdisciplinary working, but a lot of us don't necessarily or aren't necessarily that familiar with how we integrate interdisciplinary working into our courses. So it's a nice concept, but how does that actually, what does that look like in practice? So we're really looking to do some research that runs alongside the development of these new programs that I mentioned that will look at how the sorts of approaches that we can use to foster interdisciplinary learning. Thank you very much for listening.